following portion of Bloom is sponsored by Orthopaedic Medical Group of Tampa Bay.
Welcome back to Bloom. Having ankle issues can be frustrating and debilitating. So what's the best treatment? Joining us to discuss Achilles tendonitis is Dr. Adam Jester with Orthopaedic Medical Group of Tampa Bay. Welcome to Bloom, doctor.
Thank you very much. Glad to be here.
Well, I see you brought a little prop here with you today. What exactly is Achilles tendonitis?
Sure. So just as a refresher, most people probably know where the Achilles tendon is. This is the ankle, and the Achilles tendon attaches the calf muscle to the bottom of the heel, and it's primarily involved in flexion. The most basic definition of a tendonitis is inflammation of the tendon. So in this case, it's inflammation of the Achilles tendon.
Yeah, and we use like Achilles as a way to define, pain. We use it all the time. My Achilles heel, my Achilles tendon. You think pain. So when you're suffering, what are some of the symptoms? And it must be so difficult for patients experiencing this.
Sure. So we commonly see this in overuse injuries, such as runners, and also in patients that have started to exercise again and may have increased the intensity or the duration of their exercise too quickly. And the symptoms are typically pain, stiffness, and swelling that will happen in the back of the ankle, back here. And they can either happen right where the tendon inserts, or it can be more centered in the tendon, in the middle of the tendon here.
So are there conservative treatments for somebody experiencing this kind of pain?
Absolutely. The vast majority of patients we want to try and treat conservatively. And I think there's two different parts to that. The first part is most people already know from multiple other orthopedic injuries, is activity modification. Sometimes we'll place the patient in a boot, rest, ice, and anti-inflammatory, and sometimes heel lifts. And then the second part, we really like to try and get these patients into formal physical therapy.
And let's talk about the biologics and surgical management of ankle tendonitis.
Sure. So there are newer injections coming out called the PRP injections and stem cell injections. They are really trying to help. We're trying to really define if that's the best treatment right now. And I think we have some data, but we require more for that. We would want to do at least 6 months of conservative treatment before we thought about any type of surgery. If a patient was still having symptoms and was really affecting their quality of life at that 6-month mark, then we discuss surgical options. And I'm going to bring the model back up.
Okay.
But essentially, in the most common form, we're taking out the bad tendon. So we're removing the bad tendon, then often we have to reattach the tendon. So down here, we would have to take the bad tendon out and then reattach. If it's in the center, then we would take out the bad tendon. Occasionally, if we have to take out too much bad tendon, that would require a tendon transfer also to regain your full strength.
But I mean, at least you have all of these options, and I think it's going to be comforting to a lot of patients to hear that, or people that might be out there suffering, that you have these new protocols that you can try for up to a 6-month period of time before you have to go to any kind of surgical methods.
Absolutely. If patients fail conservative treatment, the outcomes from surgery are very good as well.
That's good to hear. What's the downtime after surgery?
So the downtime for surgery is 6 to 8 weeks of really activity modification and then getting back into therapy to regain strengthening. But it is an extended recovery period for to regain full strength, up to 6 months.
But you can still scoot around on one of those little boot things, right?
Absolutely.
Yeah, I see people all the time still living their life to its fullest. Well, thank you so much, doctor,
it's my pleasure.
for joining us.
Thank you for having me.
For more information on Orthopaedic Medical Group of Tampa Bay, visit their website at omgtb.com. We'll be back with more Bloom right after this, so don't go away.
The preceding portion of Bloom was sponsored by Orthopaedic Medical Group of Tampa Bay.